Good morning. Hello, everyone. I'm sorry to be a bit late, but with the launch of the new report and the preparation for the launch of the new agency, the agenda those days is really hectic. So, but I definitely did not want to miss the webinar and the opportunity to support this activity. This is one of the many instances in which we are trying to develop new activities, especially in the future, in the context of the new agency. The topic of the prevention in festivals, not only harm reduction, but including harm reduction, is extremely important, which is one of the reasons, for instance, why we are in contact with Belgian colleagues and partners from the focal point, the drug coordinators, but also the organizers of Tomorrowland Festival, because those are places and moments when we have so many participants, so many young people, and potentially so many people who may face the risk of consuming substances they don't know, and in some cases that may have a terrible impact on their health and their life. For some of them, in Tomorrowland, there were 2 people died from overdose last year, if I'm not wrong, which still is not so much if we consider that Tomorrowland last year it was counting 400,000 participants. So that's a very important topic, and I think in most of the cases, we as the European Drugs Agency, we want to develop a specific area of activity. I know that there are many projects existing and a lot of experiences existing in the member states. This is why the project that we are currently preparing is aiming at putting together the expertise and the resources from the different member states, from the civil society, but also from the national programs. I know, for instance, that in the Netherlands, Trimbos, they have a specific program for prevention in the festivals. And so here the idea is certainly first to identify and to help people like the speakers today to present their experience, to share their ideas, to understand better what are the needs, sometimes also what are the challenges. Certainly, well, those of you who know me, they know that I don't like really negative definitions, but sometimes it's useful. So what we don't want to do, what we don't pretend to do is to have a kind of a uniform or harmonized European approach for music festivals, but rather to federate, to support, to identify good practice, interesting experiences, and to provide support, including in the way we can inform national authorities and support the update when needed of national strategies and action plans concerning what we consider is possibly or potentially a good or best practice. And last but not least, I think as we have said yesterday during the launch of the European Drug Report 2024, I think for the moment, this year and in the coming years, we know that we face the risk of having bigger use and consumption of synthetic drugs in general, including of synthetic opioids. There have been some alerts already in some Northern European countries, but also in Ireland. There are already some emerging problems in the UK, for instance. And therefore, we cannot afford not to be ready. It's not only about the new mandate of the EUDA, which is about preparedness. It's about the fact that we have information. We have a lot of interesting experiences in Europe. They are not always well known. They are not always enough supported or financed. But certainly, with all the information we have today, we have no excuse to avoid to take initiative or support programs that can help to save lives. And all of that in full respect of what are the specific national or local legislations or priorities, and therefore I insist, it's not about pushing or promoting some specific services or one specific model, but it's really to integrate and support the development of what we call harm reduction system, which is a combination of interventions, and it cannot be dissociated for prevention programs. So I think with the guests we have today, the speakers today, we have a fantastic opportunity to discover a bit the work in those areas. I thank them for their presentation and their participation, and I'm very curious to listen to the lessons learned from their experience to see how can we, as the future European Drugs Agency, can try to be even more useful. Thank you very much.
Thank you very much, Alexis. We really appreciate your presence today in a very busy moment, coming from one meeting to the other. And we hope you will be able to stay for the final remark. And I would give the floor to Ines Hasselberg. Today, she's the chair of this webinar. Thank you very much, Ines. The floor is yours.
Unmute myself. Okay. Thank you, Marika, and hello, everyone. I'm very happy to chair this webinar today. We're going to have an incredible panel of speakers lined up, and I couldn't be more excited about the insights and perspectives that they're going to share with us. I'm sure that this will be a very engaging and very informative session for us all. We will have 3 questions for our speakers, and each question will be answered by all the speakers before we move on to the next one. Now, let's get started by introducing you to our first speaker. Mika Oja is a senior specialist at the Department for Drugs and Addictions of the National Institute for Health Development in Estonia. Mik is leading the Night Ferries program, which is part of a mainline nightlife harm reduction service, and counts with the work of about 40 specialized trained volunteers who provide support at festivals, clubs, and underground events. We also have with us Elisa Fornero, who is a social worker, and since 2015, she's also the manager of New Travel Project. She's been involved in developing drug checking in Italy. She's also a member of NewNet and of the TEDI network, a tutor in social work, and a junior researcher at the University of Turin. We have Mar Cunha, who took their master's degree in pharmaceutical sciences. They work at Cosmic Care's permanent drug checking service in Lisbon and in festivals throughout Portugal. Mar also works with the queer community, organizing peer support, harm reduction, and queer care teams, workshops, and events with queer collectives from Lisbon and Berlin. And last but not least, we have Gabriel Burkowski, who has been engaged in the psychedelic party culture for more than 2 decades. With his wife Magda, Gabriel leads the Dat2 Sci-Help, a harm reduction organization that provides services, offers support, and distributes supplies at Goa and psychedelic trance parties and festivals in Hungary. He's also an active participant in a series of conferences and events on psychedelic studies. So thank you all for being here. Now let's dive right into our first question. Mar, can you tell us what are the types of events and festivals that you work at, and what are the goals of your interventions?
Hi all. Ines, can you give me access to the moving the slides, please? Thank you. So I will start by introducing Cosmic Care, the work we do, and the types of contexts that we intervene. Briefly, Cosmic Care is a non-governmental association, and we've been working in festivals since 2006. We also have a permanent drop-in center in Lisbon since 2019, where we provide the drug checking service and also harm reduction materials and info. And in festivals, just to contextualize the type of events we'll be talking here, these are large events, sometimes up to 10 days long. These are events with very intense stimuli, like very loud music, sometimes 24 hours a day, 22 hours a day. There's also a lot of heat, like at least in Portugal, sometimes it gets to 42 degrees. So it's really, really intense. there's a lot of dust, there's crowds, and all of these factors make it prone to people not sleeping much. You're also doing a lot of exercise the whole day, moving around. Maybe you're not eating so much as well, not drinking enough water, and all these factors increase the risks associated with being in these places, besides the drug taking itself. So what we do at festivals in response to all these risk factors and how to decrease them, we have an info hub where we provide harm reduction materials. You can see here in the pictures. We have flyers about the different substances, harm reduction materials, condoms as well. And we collaborate with other harm reduction teams and projects. For instance, scanner projects with the TEDI drug checking network, and also a hair drug testing analysis as another way of monitoring. We provide the drug checking service. For those who never heard of it, drug checking is the chemical analysis of psychoactive substances, followed by harm reduction information and a brief motivational talk with the person. This means that the person comes to our service and they willingly provide a bit of their sample of their drugs, and we can test them. And we can tell what is in there, if it's the substance the person was expecting or not, and also to detect what else is in there, the adulterants. And then based on this, we can give harm reduction information adequate to the real content of people's drugs. This is a portable laboratory. We bring everything with us and we work on the field during the festivals. Besides this, we also have a psych care services, meaning if someone is going through a difficult experience, either drug related or not, for instance, gender-based violence or mental health surges, people can come to us. We have a quiet space for people to rest. We have a large team of psychologists and psychiatrists and much more other workers, and people can find a quiet place without visual and sensorial stimuli and have support in this way. And this was what I was meant to talk. We can see more according to what my other colleagues present.
Thank you, Mar. Elisa, do you want to tell us a little bit about New Travel Project as well?
Yeah. New Travel Project is a partnership between a public agency from the National Health System and a private organization, an NGO, and I am from the NGO. We intervene in different kind of settings, like in the city of Turin, in clubs, but also in social spaces or in street parades. We intervene in big festivals, especially in the city of Turin, and sometimes in the mountain of the Piedmont region, especially during summer, and like in Psytrance festivals. But then the travel actually was born to intervene in free parties that are the illegal raves. In the last 2 years, we are not intervening in illegal raves because we have a law that is punishing the creation of this kind of settings, and since that time we have not seen big illegal raves as we were used to intervene. We have different harm reduction tools to intervene in all these settings. The info stand with harm reduction and risk reduction tools, but also drug checking that Mar explained before. What is this service? And in free parties and also in big festival or in medium festival that are not able to have a health area and a first aid point. We set up the first aid point that basically is managed by nurses, and we have a connection directly with the central emergency service of our region, that is mainly Piedmont region. We intervene mainly here in the northwest of Italy, but thanks also to the collaboration with other Italian networks like the Italian networks of harm reduction and CNCA, we are able also to support other colleagues all around Italy during interventions. And I would say that for this part is everything.
Thank you, Elisa. Gabrielle, I understand your work is more focused on psychedelics. Can you tell us a little bit more also of the events that you work at and the goals of your interventions?
Yeah, sure. So we are a grassroots organization originating from psychedelic action scene, meaning that most of our volunteers are party attenders who got together to help one another. So in a principle of everyone gives, everyone gets, people for the people. So we are not backed by any organization or governmental services or anything like that. We mainly attend psychedelic co-actions parties, as I mentioned, but I'll extend on that a little bit later. Where else we can go? We go to parties and festivals in Hungary and sometimes abroad. In the winter season, we go mainly to indoor parties in the clubs, and in the summer, we attend outdoor festivals. The goal of our intervention is to support the party and festival attendees with all three pillars of harm reduction practices that are 1, physical well-being, 2, mental well-being, and 3, providing information. In the physical well-being, we provide water, minerals, vitamins, fruits, salty snacks, earplugs, condoms, provide safe space for people to rest, get some shade if this is a festival setting, much like the speakers just before me explained. In the mental part, we provide safe space also for people to rest, give some psychological help. We also have psychologists on our team talking through difficult experiences, sitting through with people, holding their hand, maybe giving a hug, and taking care of what most people will know as bad trip, but we prefer to call it a difficult experience because it does not mean it's going to be bad. And we also help people in integrating the psychedelic experiences after it's already finished. And on the providing information side, we give information about drugs, drug use, drug combinations, law aspects. So what rights do people have if they get caught with small amounts of drugs, what to do, what not to do, what to say, what not to say to the police. And also we provide some information on cybersecurity aspects, such as how to protect yourself in the digital space, what not to share, what information not to keep on your phone, not to provide evidence against yourself if you get in trouble later on.
Thank you, Gabrielle. Mick, what about the night ferries? Can you tell us more about it?
Hello from me also. Yes, well, the Night Ferries project is from Estonia, and I would say that it has been the fruit of a very close collaboration between an NGO that actually coordinates the volunteers. It's volunteer based, but I am representing the National Institute for Health Development, so we are also closely involved in all their doings. So I think in overall, I would say that our interventions are similar to the previous speakers. We also usually have the info stands providing different informations, different harm reduction supplies. People can come up to the, for example, the tent if we are at the festival and talk. We have the drug combinations tables there. And but also we do if we have like one place is a stationary like a tent, then we also have the outreach teams who go around the festival and actually see if there's a drug related problem, if somebody needs help, or of course it's always you need to prevent the problems also. I think that's maybe even the main goal is to actually see before the problems come up. And they're also working always together with the staff of the festival of events. But I think I have always thought that the third our big goal is also to like create a safe space, and that means in a way like even wider than the event itself. Like we have a growing Instagram account that we are very active on. I think we're a very new initiative. I think compared to the other presenters here, we're just like 2 years old. That means that the topic is really new in Estonia. And I think we are just like starting the discussion on these issues. So we also do, yes, the festivals in the summer season, and in the other times we also have the like nightclub smaller interventions, because I think the space where you're acting sets some kind of boundaries also what you can actually do there. If sometimes the clubs are quite small, so you can't have like a psych care area there. You just don't have room for it. So I think we started out in these, I think I would say like smaller transformational festivals and alternative clubs that I think in those communities, they already understand the value of harm reduction and child care better than maybe the mainstream clubs. At least in Estonia, it's like that. So, but we're now developing, trying to expand our range of events also to outside of the capital, and like 2 bigger festivals all around Estonia also. Thanks.
Thank you all for your answers. It's quite impressive work that you're all doing. Mick, we'll stay with you for a little longer as I'll move to our next question. And so thinking about your experience and the challenges that you have faced and the successes that you've had, are there any best practices that you would like to share?
Yeah, thank you. Best practices for me seems to be something that need to have like good proof behind it. But since we are just like 2 years active, I would say that it's hard for us to tell that yes, this is a best practice, because it kind of feels like you're still piloting everything you're doing, because it's so new. You have lots of new issues coming up every year. I think we have worked a lot on our messaging. We have designed different products. For example, maybe you can see on the slides also, one of the latest products that we designed was like these like small papers. Yeah, these are the ones that have harm reduction messages on them, but they're used to roll up, and people who use drugs by snorting them, so you can use them as a clean paper and stuff like that. So we're working on our different messages, designing them, but we also put a lot of effort in our training program, because we are volunteer based. At the start, we had like this one time a year, this big training program, but we understand that if you have volunteers, then they are joining all throughout the year. So they would just have to wait for the whole year to actually join our working force. So we had to design the course, an online course, and then we have like once a year, we have this bigger like in-person practical period when we do the trainings also. For example, one of the new things we have been trying to do is to develop these nightlife simulations. Like we gather different difficult situations that we have been through, and then we like act them through. So we have new people who join them. They can like it's I think it's like a more practical way of understanding the problems than the theoretical side. But I think also that one of the success stories has been also that in Estonia, I think our intervention night fairs has become like a how to say, like a in a way representative of the nightlife scene, especially in drug-related issues. So if we are like considered a trustworthy partner whenever these like new initiatives are somebody's making something somewhere, for example, even with law enforcement or we are always like involved in those issues, so we can share it with them. We're trying to build this network, but yeah, bring together maybe the underground nightclubs and law enforcement and maybe the governmental institutes. So it's I think we are like a mediator somewhere in there between. Yeah, thanks.
Thank you, Mick. What about you, Gabrielle? Any best practices or lessons learned that you would like to share with us?
Yeah, we have many challenges and some success stories. So in Hungary, it's a pretty challenging atmosphere because of the political situation, where mostly it's anti-drug propaganda rather than the support don't punish approach that we would like to see. Because of that, there's no real funding or support for organizations like the ones we work in. The law also is criminalization of all the substances, all the possessions and everything. So it's pretty difficult for the people who try to use drugs on the parties, or at least be around them. There's real lack of education in the sense that people who are young and they go to the parties maybe for the first time trying to dive into the world of drugs, they don't have any background. They don't know what to do, how to do, what not to do. So they learn on the fly, they learn from their friends. And if they're lucky enough, they meet people like us and they can learn some real information how to not harm yourself. There's no nationwide drug strategy in Hungary at the moment for many years, which is really a bad thing. There's no drug testing, as mentioned, the speakers before me have this privilege to check people's drugs and save lives. We don't have this possibility in Hungary. And we have even difficult situation with some of the club owners that are so profit-oriented. They are preventing people from drinking water from the tap because they want them to go and buy it in the bar, which is a really difficult situation for us, where we try to provide harm reduction services and they make it even more difficult for us. But on the other hand, we have lots of successes. As I mentioned before, our organization is completely grassroots. We just got together, started helping each other, and just a week ago, we celebrated 11th birthday of Sci-Hub. So we are not supported by any organization or government, and only comprising from party attendees who voluntarily joined to help one another. And it somehow magically works for 11 years, which I think is a success in itself. We are recognized in Hungary and collaborating with many local international organizations, which is a great thing for us. Another thing is that sometimes we have a customer who has a difficult experience. We help them through, guide them through it, and they come back and say they want to join us. They want to help others. This shows clearly that they understand. They got the understanding of the importance of harm reduction. They received help and they want to give it back. And this is really great story when we have our own people who have been through the experience, who got help, and they want to provide it to others afterwards. And as I mentioned at the beginning, we are coming from the psychedelic co-trans party scene. And recently we are being asked more and more to attend parties from different other party organizers outside from this community we've been working with, like techno and sometimes even general music festivals. And I might add, these are often young organizers, 20, 25-year-olds. I'd even call them the next generation of organizers. And again, this shows they understand the need for harm reduction. It's important for them. And they were the first ones to come to us and ask us to do, apart from the usual harm reduction that we talked about earlier, they asked us to do some lectures, workshops to educate young people, young audience, so they understand the dangers involved in the party and drug consumptions and how to do it in a safe way. And as for the best practices, we wrote our own manual, actually even 11 years ago, on how to conduct and build a harm reduction organization, how to do the interventions on parties and festivals. And we also contributed to the one I would like to mention and advise to everyone who would like to dive into this kind of topic, a manual for psychedelic support. This is a 400-page document written by, mainly published by MAPS, Multidisciplinary Association for Psychedelic Studies, but the contribution to it were from many organizations like Cosmic Air and by Psy-Hub and many others, based on our experiences working on parties and festivals. And this is a very good, very comprehensive document that actually takes all of the knowledge and experiences we had around the world, from America through Europe and all the other countries, and explains how to do psychedelic harm reduction.
Thank you, Gabriel. Picking up on that, I wonder, Mar, if you would like to share something with us, also, considering the experiences that you've had and the challenges and successes, if there's any lessons learned or best practices you would like to share.
Okay, so thinking more about best practices applied to teams that will work in harm reduction, I think it's essential to work with peers, meaning people that already are attending that party, people that attend parties like this. Yeah, not only to take inputs from people about their needs, about what goes wrong, about the drug that are circulating, how people are taking them, because sometimes as an organization working in these events, it can be hard to keep track of everything. And different subsets of people have different ways of taking drugs and contexts. So I think it's super essential to learn from peers. And also to give workshops and formations to share these scientific harm reduction information with people that are already attending the party, because in this way you are empowering people and you are spreading the message much wider. And of course, as all of the organizations here do, yeah, we work with volunteers and peers and sometimes also paid labor for people to work with us. So we are just organizing the service. Then we have a lot of people in the community. Also, the people organizing the service are peers from the community as well. But it's important to reach as many different communities as possible. For instance, Cosmic Air started working more with the queer community, and yeah, it brought a big change also to reaching different communities and drug users and peers. And then I think it's also important to, as a party goer, to really prepare for this environment. A lot of festivals have some guides on their website letting you know of the, like, we will have tap water available throughout the site or not, or certain things you need to bring, like jacket, it gets cold at night, all these things, especially if it's the first time you're attending a festival. And then also a super important thing that even seasoned partygoers sometimes don't consider in long festivals is to really think about your drug use. Like, there are many days, you should account for days to rest. And also sometimes the order in which you take drugs, it can also be smart to think about this. Like, which drugs are you taking on the first days and then the last days, and which drugs are you mixing or not? And yeah, I think all of this can make a big impact in the experience you have and having a safer experience as well. Yeah.
Thank you, Mar. Elisa, I give the floor to you now.
Well, I think that all the other speakers said what are the most relevant challenges that we face, that are very similar to those that we face in Italy. But if I think about the history of no travel, for sure, our main challenge was to keep people fresh, especially during summer, because free parties, but also the big festivals in the city of Turin happens during summer, and this can be a big challenge to provide free access to all the participants. When you have 20,000 people in a place, it's very, very difficult to reach this goal. But also some injuries due to the context when you are in the mountain, or as Mar was telling, you went to a festival for many days without a proper jacket. During the nights there is perhaps cold and hot during the day, but also for instance, free parties were used to happen in abandoned factories, so with a lot of holes and also electricity around. It was not like a big safe place, I would say. But another challenge that we were facing, but we still face, is about to be able to make act in synergy all the actors that are involved in the party. So there is not just harm reduction, there are organizers, crowd owners, DJs that are stakeholders for us, but also security teams, or in big legal festival, the first aid point, in illegal raids, but also in big festival, the police. You have to consider all these actors, and the goal of everyone is that to protect people's health and to keep people safe. But it is difficult to act everyone in synergy, especially in big events. Then another challenge that we had to face was to be able to cover many days, especially in free parties, has harm reduction, because when you have a technical of 6, 7, 8 days, it is very difficult to have people and volunteer enough to be able to cover also in a professional way all the events. So this is especially due to funding, because we would need more funding, but and also to be able to cover big events. Anyway, during our history, we were able to cope a little bit with these challenges, because, for instance, as I mentioned before, in the Piedmont region, we have a protocol with the Central Emergency Service, so we are able to act quickly when an injury or a big harm happens, and so we are able to send the person in the hospital as soon as possible. Then to cover big events, we decided to act with the networks, so with the Italian networks, the CNCA and the Italian Network of Harm Reduction, but also with NewNet, because we had some intervention where people from the European networks came. And this was a strategy that was very satisfying for us, because it was able to create a link on field with professionals and to start to think as a network, as a collective body, I would say. Then sometimes we still experience some difficulties to introduce drug tracking, especially in small club or new context that we are going to intervene. But in the Piedmont region, we are very lucky, because drug tracking is in the regional health law. So it is like a basic level of assistance. And this allows us to be more, I would say, more safe, also for party organizers that don't understand a little bit this kind of services. And this success was gained thanks to the partnership that we have with the local public agency from the NHS service.
Thank you very much, Elisa. We still have one more question to go, but before we move to the final question, I wonder if the speakers have any questions or comments to each other. I see that there was a lot of common ground in terms of the challenges you face, and in terms of seeking for partnerships, etc. So I was just wondering if, before we move on to the next question, you have any comments or any questions that you would like to ask one of the other speakers. No? Okay. We'll move to the final question then. So what we'd like you to share with us now is, and Elisa, we'll start with you now, is looking ahead, how do you see trends changing, and what do you think you can do to prepare for it?
Well, I think that harm reduction worker are like researchers, so when anthropologists, they stay on field and they have to monitor, but also to study the different evolution of the different subcultures, because a big part of the planning of an harm reduction intervention, I think that have to consider the subculture you are going to meet. And in the north of Italy, we are seeing something that is changing, because once we were able to recognize different subcultures, so illegal raves, club and techno and psytrance and blah blah blah. But now all these subcultures are mixing, and we have this new kind of events that are legal events, but they are also secret party. So they are like a mix from an illegal rave and legal events, and this can pose some challenges also to prepare your team to intervene in this kind of settings. And in terms of use of drugs, in Italy is very popular the Calvin Klein mix, so mixing cocaine and ketamine. And now we ask for more funds to have more research on this, and so to understand what are the meaning and also the motivation of this kind of mix, considering that the poly use of substances is what we meet at least every day. What else? I would say, yeah, these are the main things. So the mix of subcultures, and also to be able and prepared to read what is happening, what are the meanings of some behaviors, or generally what are the meanings that kind of settings brings, and to be able also to understand the meanings and to keep in touch with people.
Thank you, Elisa. What about you, Mar?
Yeah, regarding future trends, and yeah, what we've been seeing is an increase in consumption of catechins, at least the perceived one we have from working in the parties since the pandemic, especially. I think the same happened in Berlin, and I'm talking about Lisbon, and the same happening in Berlin, that people started taking much more catechins during the pandemic, and the trend keeps on going now. And what we've been seeing in the drug checking service is a constant change in which catechins are circulating. Yeah, if people first were taking 4-MMC, then it started being appearing more 3-MMC, then it got forbidden. Now we have a lot of 3-CMC and 2-MMC more recently. And yeah, of course, this brings a lot of challenges working with people and for people to take drugs, because not only you have a lot of new substances appearing, some of them very recently synthesized, meaning that we don't know, and like even science doesn't know the effects they can have. It's very hard to know doses and durations of the effects because they are very recent. And you can only get information from people taking it, and it's very hard then to build harm reduction approaches to this and know what to tell people when people ask, okay, but what are the difference between these and the dosages? It's very hard. And I think this also relates to other new psychoactive substances. As they appear, you get all these new challenges, because with older, more established drugs, for instance, MDMA, it was developed by a pharmaceutical company like many decades ago. So you already know the effects that it can have long-term and short-term, and the dosages. But with new psychoactive substances appearing, you really don't know anything. So this makes it much harder. So I think this is a big challenge for the future for these interventions. Yeah. Yeah, I think this is it, basically.
Thank you, Mar. Gabrielle, do you see any trends changing, and how do you prepare for them?
Yeah, so a little bit I'll echo what Mark just said, because of the criminalization of substances. There are constantly new psychoactive substances appearing on the market, sometimes called designer drugs. And as Mara already mentioned, it's very difficult to work with it because we don't really have any data or information on how they use them. And unfortunately, this is a trend that's happening all over the world. Instead of just working with established and known to science drugs like MDMA or, I don't know, psychedelics like LSD, people start taking things that no one ever heard of, and they've been synthesized in some shady labs somewhere in Asia, and we have no idea why they are feeling bad and tripping for, I don't know, 24 or more hours, and it's very difficult to work with such situations. Another trend which is difficult is the age. People who attend parties and festivals are younger and younger each year, and it's again more difficult to work with them. You need to reach them, approach them. They are from different generations, so it's different way of talking to them, and it's way more dangerous for people to start taking drugs in very young age. So that's again a challenge. And of course, as I mentioned earlier, the whole atmosphere, at least in Hungary, which is not going in the direction of support, don't punish. We would love to see this trend to change in the direction of the governments and the law and all these aspects we talked about earlier, to change in a direction where we support people who take drugs, don't punish them for that, because it should not be like this. And another trend is that we are living in a digital era. There's more and more information on the internet, on all sources, websites, social media, and so on. And sometimes it's very difficult for young people to navigate in these spaces because there's so much information that they don't really know where to look, how to look, which information is reliable. So I think what we would need to do, all of us, not just Sci-Hub, but the other organizations which are present here, is make sure we are present in the digital space and thinking about providing the services in digital space, as already mentioned with others also, maybe doing an application, maybe doing a chat service, maybe doing a website, maybe doing all these things. So be sure that we are reaching the audience which is grown up in the digital space, because the next generation is already in the digital space from the get-go, and we need to ensure that we are there. And of course, as all of us, we have to continue fighting for changing the law aspects and the political scene and the support for organization. And as I also mentioned before, collaborating with one another. So calls like this, speeches like this, podcasts, and all sorts of initiatives are very good. And I'm very happy and grateful that we all can be here and benefit from it, not only the audience, but our organizations also. So thank you for allowing us to be here, speak, and share our experiences.
Thank you, Gabriel. Mick, what about Estonia?
Yes, I think one of the trends that has been the most alarming for me in Estonia is that when we look at the lifetime drug use prevalence among young people, it's good that it hasn't been rising in the last years. I think it has like stabilized, or it's even decreasing a bit. Also, that's I think for like alcohol among young people, but the overall image, like on the media, and also when we are in the nightlife, the overall experience of people is that it's getting worse. That the problems are getting worse, and so there's like a how to say, a contradiction that people aren't using more if we look at our studies, but people see that we are using more. But I think this has been also like a tendency in some of the Western countries also, that we see that the overall like use is not going up, but the ways people are using drugs is getting more riskier. Like people who use drugs are using more frequently. There's more polydrug use. We see drug-related deaths rising among young people in Estonia also. And especially wearing, yeah, these are just the overall deaths in Estonia, but not especially not only young people, but this is overall in Estonia and the Baltic states. We are seeing again surge of new novel synthetic opioids, nitazines, that are causing the big increase in deaths. And I think there's a bit of a perfect storm coming together with young people using more and more prescription medicines, also recreationally. There's a issue that some of the prescription medicines might be like overprescribed. They're easily available, and young people like to use them, like benzodiazepines or opioid medicine also. But at the same time that young people are using them, we are now seeing counterfeit fake pills also coming up that are containing nitazines, like the very strong opioids. So I think there were like the few first cases now quite recently in Estonia, but there have been more cases around, like in Finland and Sweden, maybe Latvia also. So I think this combination of popularity of prescription medicines among young people and the coming of nitazines in them is really troubling. So in Estonia, we don't have drug checking, unfortunately. That's also an issue that we, I think that's the number one like topic that we get asked in nightlife from the visitors, that why don't we still have it? So I think we're also developing like the early warning system in Estonia to better combat these new strong synthetic opioids, for example. But I think in a wider sense, I think if we're developing like the new early warning system, it's good to see that the night ferries or initiative is also involved in the building of this network, that we are seen as the channel how to give warnings to some of the like nightclubs and festivals. That's really good. But also it was mentioned by other speakers that we are also like it's not only that we are giving out information, we are also gathering information from the communities. That's it always goes like two ways, I think, because okay, we have the general population surveys, but about what drugs people use, but this is a very slow process to evaluate the changes on the drug markets, and I think it's very important to for the nightlife initiatives to actually be there, know the community. Usually lots of our volunteers come from the community themselves, and they know the people, and I think it's a very important exchange of information. Yeah, and last year I think there was a tragic death also in Estonia at a festival. And after that, you can also see that there have been like the field has been like awakening a bit. That it's unfortunate that you have to have these tragic events for people to start realizing that we need to do something, that we need to work together, and yeah. But you can see like this. Like the topic is has gotten really much attention over the last year in Estonia. Yeah.
Thank you, Mick. And picking up on what you were saying, actually, a lot of the members of the panel were saying about changing patterns of use. I'd like to take the opportunity to let the audience know that we are currently launching the European Web Survey on Drugs, which is trying to understand the changing patterns of use precisely. This is voluntary and anonymous survey, and it's run by the EMCDDA with its partners. We will put in the chat the link to it. If you click on the link, you'll see a subheading that will say links to surveys in participating countries. So then if you click on your country, you'll be directed to the survey. So having said all that, I'd like to thank all our speakers for their contributions. I feel that you have provided us with a lot of valuable information and food for thought. And now we would like to open the floor to questions from the audience. So if you have any questions to our speakers, please feel free to submit them. You have the Q&A button for it, and we'll try to address as many as we can in the time we have left. And for this, Marika, I'll give the floor back to you.
Thank you. Thank you very much. There are already queuing some very interesting questions. Let me have a look. This is a very interesting question. Brit asks, how do you avoid providing information to people who don't use drugs? As this could make people curious about drug use and therefore could lead to drug use in itself. Who would like to start answering this question? Elisa, please.
I can jump in.
Elisa and then Gabriel. Ladies
Sure.
first.
Sure.
Go ahead, Elisa.
Well, personally, I don't think that giving an information can trigger a curiosity, and then the kind of information that we give, that we provide people, is about the effects of drugs and the risk that you are going to take if you decide to consume a drug. And in our kind of intervention, we also aim to inform people and train people how to act if something is going wrong. So I think that it is not this kind of information that triggers a curiosity, because in what we see, especially in the last year, is that drugs are very, very spread. And it should be better that also people that use them have information and are able to manage what are the risks, and also to manage when an injury or a crisis can occur, and to recognize what they can do and what they cannot do, and when they have to call the emergency service to save life.
Thank you. Gabriel, you wanted to go after?
Yes, sure. So we are not avoiding providing information to people who don't use drugs. We have people on parties and festivals who approach us and they don't, or they never use drugs, and they ask questions and we provide them information. The first thing we usually say is we are not advertising the drug use. We are not telling people not to use drugs either. We are just telling them, if you do use them, then this is the way you can do it safely. And this is the harm reduction approach that we are taking. And this is what we are trying to teach people. And if there are young people coming to us and asking about what are we doing and why are we talking about drugs and they never use them, if we can teach them to use drugs safely if they will start one day, that's already a bigger success. We are not trying to increase the drug use, but if someone will start using the drugs, it's way better if they start using it safely than without this information we can provide.
Thank you. Any other comments from Mar or Mick? Okay, we can move to another question. Hans, I hope I'm pronouncing well your name. Drug checking clients are based on research, still predominantly educated white males. Do you feel your services reach also the most vulnerable? What helps most to reach the most reckless drug users? Who would like to say something about it? Mar, yes, please, go ahead.
Okay, so yes, this is also a thing we've seen in research in users that use our drug checking service. Most people that use our drug checking service are white cis men with education above like a college. And yeah, what we try to do for this is to also promote the service in other places. So to be in events and parties, but also working with people that use drugs in more vulnerable contexts. So what we realized after 3 years of having a drug checking service open is that people that use drugs in more vulnerable contexts, of course, will not move to a place and then give a bit of the sample and wait 3 days before taking their drug. Like, people are buying just a bit of the drug, they are taking it every day in vulnerable conditions. So the only way of reaching this public is to go there physically with the laboratory. We've been providing drug checking in assisted consumption rooms, and also with the teams that go to the fields and distribute syringes. And we work a lot with peers of these people, of course, because that's the way of reaching people. And yeah, I think you really have to adequate the way your service works to reach different populations. Yeah.
Thank you. Thank you very much. Anybody else would like to add on this aspect? Okay, I move to another question, and then if any one of you wants to jump in, please do it. The question is by Andreas. One mentioned ketamine, and a study started for using intravenous ketamine for opioid dependence. I'd like to hear your opinion about this, and also if there are any information available about it. Have you heard anything about the use of ketamine for treating? I don't know if it is really, really relevant for you. If anyone want to jump in on this, we'll probably suppose we can answer. Elisa, go ahead.
Well, it is not exactly about the question, because it is also for me the first time that I hear the intravenous use of ketamine to treat the opioid addiction. But we saw a decade ago a lot of spread of inframuscular use of ketamine, and now we know that in Italy it's coming back again, especially in those people who are using ketamine daily, and they are using high amounts of ketamine. We consider this kind of pretty risky because of the injection of drugs, and also because of the kind of effects that it gives. But at least I think that this kind of research that was mentioned was about to have this kind of therapy in supervised setting.
Thank you. I was scrolling the questions. Sorry. So thank you for your answer. I move to another question for everyone is, do party organizers have to pay or have your project on the event? If yes, only big party organizers or everyone? Who wants to say? I think you all mentioned that.
Maybe.
Yeah, please.
Yeah, it has been a hot topic for our intervention also, because the main funding currently to the NGO comes from our institute. But it's as our service has been growing, it's clear that it cannot be supported only by our institute. So our NGO is now looking for if they can find like private support from the private sector, and they have been also asking like some service fees to cover the costs, like for traveling and accommodation. And it's a really difficult topic also, because because some of the festivals can provide you with like a place to sleep, and but some can't. And the costs, if you have a festival in a city or a place and they can't provide you with, then the prices are like really, really high to find somewhere to stay there. So it's very different, like who can provide something. And it's also an issue that some festivals can pay for it, and some really don't have the funds for it. And I think the main goal for our intervention should still be like where do we see the most harms, or where do we see that we should do more work, not pick the festivals that just pay more. I don't think that will be the goal of the intervention. So also it's as it's still a very new intervention in Estonia, it's hard to actually understand how much who is willing to pay or how much should it be paid for this kind of service. So it's like really changing all the time, and we're still like trying to figure it out, trying to figure out the model how to actually like solve this issue. But it's an issue for us also. Yeah.
Thank you very much. There is another question addressing Gabriel specifically about the age of party-goers. So Bert says, Gabriel mentioned that people participating is getting younger, while in Belgium and in studies, it says that there are people in their 30s, while after the COVID, the younger generations is not getting more. Can you probably all explain something about the age of the typical clients you see in the parties?
So with us, we see different clients on different parties. We do have people in older age. On some psytrance parties, we have clients above 60. So the age limit, there's no age limit. And but that trend is that people are younger and younger. It's not surprising when we see someone approaching us who is 16 years old, officially illegal to be in the party alone, and asking about drugs. So the trend is that people are younger and younger who attend these parties and who do try to party using drugs. And I don't know if this trend is only in Hungary. I don't know how it is in Belgium, but here we see this trend definitely of the age being lower and lower each year.
What about the others, about the age of the participants in festivals?
Well, we have this strange data since 2008. The medium age is 22, 23. So it is like there are always people changing in the kind of setting that we are going to intervene.
Anybody else comment on the age? Mar, please.
Yeah, from our drug checking service, which is the place where we collect people's ages because we don't have this for overall attendance. Yeah, it's usually like 20 to 30, around 25 as well. I don't necessarily see a trend like now talking as a party goer. I don't necessarily see a trend of like more young people or anything. It's very varied. Yeah.
Mick.
Yeah, I don't have like an overall evaluation of the trends on the age, because I think it really depends on the festivals and events that we're going. But I would maybe have like a small question for other presenters also, is that do you have like festivals where there are underage people? I think Gabrielle just mentioned it. That how is your intervention like different if you interact with underage people, or how they work in that situation?
Who wants to answer Mick's question? I would like to ask a question. Okay, Elisa, please go ahead.
Well, depending on the party, generally, we don't see people under 15, 16 years old. But I think that this is due also because of the difficult to be able to access festivals because of the ticket, free party, because of you need a car to reach free parties and things like this. Anyway, sometimes we have people of 16, 17, but actually, we don't ask the age of people that are benefiting from our services, except in the drug checking. And the data that I gave before comes from the questionnaire that we usually administer in every event. But we think that there must be no difference between all the ages because information can prevent risk and harms. And so, yes, we don't have differences.
Thank you. Any other comment? I would like to briefly ask you a question, and then we leave some minutes to our director for his concluding remarks. My question is, in the festivals, we saw also ambulances, healthcare, fire brigades, police. What is the collaboration with the other professionals, if any, attending these festivals for intervention reasons? So I see two hands, Gabriel and then Mark.
Yeah, so we usually try to approach both the security services of the festival and the ambulance or medical services, introduce ourselves and talk with them, explain them what we do. Security services are sometimes difficult to work with because of the nature of how they've been trained and taught, but the medical service is usually very, very appreciative of what we do. They are very helpful and collaborative. They help us in what we do. They appreciate what we do, and we give ourselves support. So if we have a customer who actually needs medical attention, we go to the medical services with him. And if the medical services get someone who is like in, I don't know, psychedelic state and not really needing physical medical attention, they of course delegate him or bring it to us, to our services. So there's close collaboration, and I think this is very good and fruitful for both sides.
Thank you very much. Mar?
Yeah, the way we work is very similar to what Gabriel just said. Everything I agree, and we do the same. And yeah, usually we have our psych care literally next to the paramedics, so it's easier to transfer people if necessary. And also, yeah, with drug checking service, it also helps a lot. It has happened before that the paramedics were dealing with a very hard case and they were not understanding what the person took, but their friend still had the drug and we tested it. And this was super helpful to get back and forth. And also, yeah, sometimes they also ask us for workshops and formations on drugs, because not necessarily you know these things from medical school or even pharmacy. So yeah, I think this is also important. And regarding security and police, sometimes, yeah, it's important to have a briefing with them and say, please don't stand in front of our service. Yeah, sometimes we have to do this through the organization, so it's less tense. Instead of us telling the police or the security, we talk about this with the organization does a briefing to them. Yeah.
Any other experience would you like to bring in? Okay, I don't see any other hands on. So with the permission of Ines, I would ask Alexis if he's available to give some closing remarks.
Yes, Marika, can you hear me?
Yes, perfectly.
So yeah, first I want to thank again Gabriel, Mar, and Elisa for sharing their experience. It was very interesting. I want also to thank everybody who attended and for the questions. I want also to more broadly congratulate and thank all those who are doing this work in the festival and all the members of the TEDI network and those who do drug checking and are maybe not members of the network, because that's a very important work. And I'm very proud that we at EMCDDA, we finally managed to establish a close partnership with TEDI and with the other networks. So a few remarks. The first is obviously from what you have shared with us, it illustrates that really the music festivals, they are a unique setting and opportunity for real-time monitoring, but also understanding new behaviors related to new substances. It's of course a unique setting for harm reduction interventions. The problem being that not everybody is still convinced or yet convinced by the need for harm reduction. But I'll come back to this in a minute. And it's also, therefore, a unique opportunity for contributing to save lives. And I think this is something that is not perceived well enough so far. But certainly that should and could be a priority for us, also for EUDA. Thank you, Anton, for asking the question I wanted myself to ask everyone, so I will propose and share some ideas. I think what was presented, the different country situation shows that obviously there are different policies at national, but also sometimes at local level. There are different settings or possible settings. And in some countries, not in others, some services are accepted or mainstream, or tolerated. In other countries, it is not the case. So the first thing is that I think, and that's one of the ideas we are discussing with the colleagues for Tomorrowland. And at this stage, I'm not sure if we will be able to have a concrete action this year, but it's not a problem. We have been already in contact 4 years ago, but because of the pandemic, we had to interrupt. I think the point here is, in the discussion we had, for instance, for Tomorrowland with some of the authorities or the organizers, well, first of all, Tomorrowland being organized in Belgium on the territory of a specific province and judiciary area or sector, this means clearly that for the organizers, there is no way to take any initiative or provide any service that is not officially accepted and acknowledged in Belgium and in the province of Antwerp. So that's a constraint, but that's the same constraint everywhere. The fact that the approaches and the policies are different, it's just normal. And well, actually, we need to respect it and cope with it. But this means that for me, the first conclusion from our experience, I'm not pretending this should be done for everyone everywhere, but here is that I think what we try to change now in the reflection is to say, okay, maybe we were, or those who, the actors from the field, not we, EMCDDA, maybe when we discussed with different partners and stakeholders the possibility to do something, probably the fact that the starting point, the idea at that time was about drug checking, and that it is clearly what was not accepted by the judiciary authorities. I think, no, if you want to establish a partnership and you every time can bring only the thing that is exactly what the other part doesn't want and is not capable to listen to, well, if you maintain just the same proposal, the only thing you get is that there is nothing happening. And you don't even create the possibilities for having a partnership and maybe to learn to know with each other and to develop a partnership over time. And this is why when we launched again the discussion with some of our colleagues from Belgium or other countries, the proposal was, why don't we propose an action on prevention, including harm reduction, in such a way that obviously what we will propose or what we can do should be allowed and authorized. And there are different ways to achieve the objectives. For instance, in Tomorrowland this year, the laboratory of NICC, that is a fantastic laboratory in Belgium, they have a mobile unit that is excellent. It will be on site. But it will be only to analyze drugs that are being seized. So if there was a project only for harm reduction with drug checking, this would be impossible. But this means that there will be a lab, and a very good one, and that part of what is circulating that has been intercepted, there will be a possibility to know. And if there is something new or dangerous or problematic that is appearing, still there is an information and there is a possibility to disseminate and to tell people, beware, take care, be careful. So there can be some intermediary options. And even if the ultimate goal could or should be that when needed and where the conditions justify, it would be useful to have, for instance, some drug checking. That's not the only option. And drug checking is still not mainstream in the EU member states. So I think for me, the point here is to create the conditions to avoid as much as possible a simple rejection of any opportunity, any initiative, and to try to build partnership. And in many countries, for many NGOs, this is exactly the process that took place when some NGOs, some harm reduction services were informing the police, or the authorities for some actions taking place not only in the festival, in different places in the city, in the society. It's establishing the dialogue, which has to become a permanent dialogue with the law enforcement, with the authorities, to keep them informed about the results, so they can see what is the added value. Some of them they can understand that it's important, and they can also understand that it doesn't mean that those activities are promoting the use of drugs, because that's one of the automatic criticisms that are being presented. And by the way, when we talk about this, I think it's important to remind that in some written statements from the chair of the INCB in 2016 and 15, just before the UNGAS in New York, that it was declared in written by the INCB that drug consumption rooms, drug checking program, and decriminalization were compatible with the UN Convention. So as long as they are part of a broader system or policy which has an objective of avoiding people using drugs. So there are options, and this is not automatically against the convention. Still, in some countries or some regions, it's possible, it's not allowed by law. But there are sometimes there is some margin for some room for maneuver. And I'm coming to the next point, which I mentioned in my introduction actually already, is the fact that today, with the situation in Afghanistan, with the ban on opium, and with the general evolution towards an increase in production of synthetic drugs in Europe, not only the arrival of synthetic drugs, including synthetic opioids in Europe, certainly there is a potential risk for an increase in the consumption of synthetic drugs. And we know that if it's confirmed and if there is a drought of heroin on the territory of the EU, this may be a cause for a shift from those who are consuming heroin towards synthetic drugs and synthetic opioids. And there was a question, I think, about nitazines. I think nitazines, they are appearing more and more in all countries. For the moment, they've been more detected, and they create already problems in the UK. There have been also some alerts in Ireland, France, in northern countries, including there were overdose cases in prisons in Ireland in March this year. So this means that I think here we have an argument to call, and that's what we are going to do in July when we will launch the new European Union Drugs Agency. We are preparing a call, a first preparedness advisory, as our agency in the future will have the possibility to make official recommendations from its own initiative. We want to make a call to call the attention to the fact that the member states are all concerned about and all afraid about the potential crisis with fentanyl arriving in Europe, even if we are not sure it will be fentanyl, and certainly the dimension of the problem would be different from the US, as the root causes are different. Still, we are not protected. It's not granted we will not have a problem. So we need to be ready. And there, certainly all the knowledge that we can use from the festivals and from the drug checking and from all the actors and the volunteers should be used because that's a unique opportunity to really understand what is being consumed today. And certainly, and I think, as I said, Tomorrowland, for instance, but it's not the only festival, of course. If you count 2 deaths last year, if I'm not wrong, out of 400,000 people, I think they are quite lucky. Because potentially, if there are nitazines, for instance, circulating or appearing in the festival, before they realize they can have 10 or 20 cases of overdose. And therefore, it's important also to convey the message, not only for the street use or street sales of drugs, but also for the prisons and for the music festivals, that there is a need to be prepared with the crisis intervention plan if there was a peak and outbreak in the use of some drugs, creating intoxications or overdoses. I think it's equally important to make sure and to inform the authorities, and that's one of the responsibilities of EUDA, together with the focal points and the national alert system in the future, to make sure to inform, to call the attention of the member states that, for instance, in the festivals, whether it is the Red Cross or the services of ambulances or the emergency teams that are ready on site in the case of a problem, that, for instance, they should have naloxone. They should have enough naloxone, because some of the synthetic opioids are more potent and much more potent than heroin, so only one dose of naloxone cannot be necessarily enough. But this means that the situation is complex with those new substances. So there should be an update of the guidelines for the prescription of naloxone. I had the opportunity to see a recent update from researchers and clinicians from the UK. I'm sure that, as it was said by some of you, in many countries, the clinicians, those who are part of the intervention teams, they don't have the most recent information that would allow them to address successfully, have a successful intervention in case of an overdose. And therefore, one of the things we would like to do, and maybe we will manage to do it this year, if not next year, is also to combine with more qualitative research on few focus groups, taking the advantage of those people who are in the festivals with the help of the NGOs and the actors for harm reduction, to understand what is the drug use or substance use in those specific settings. We have also a new platform that we have developed with Teddy for communication and data collection that should be useful also for that, maybe in the future. We will establish a European network of laboratories of toxicology and forensic. This network, maybe in the future, could also provide some support. And I understand, which is partly the case in prisons, that in some cases, even simple tests are not available, just to make sure it's a nitazene or it's fentanyl or not. So there are solutions we could explore together. And finally, I want to say that most probably in the coming 2 years, we could explore the need for a mini guide or for best practice on prevention and harm reduction in festivals, because I think we have also an opportunity. The fear about fentanyl, the serious risks about potential new epidemic, even if we don't know yet which one exactly, means that member states being a bit more aware should be put also a bit in front of their responsibilities. There is a scandal in the UK for the moment about contaminated blood during the HIV/AIDS epidemic. But there was the same crisis 30 years ago in France, and the minister tried to find an excuse, saying that, declaring that he was responsible but not guilty. But I must say that with the knowledge we have today, this is an excuse that will not pass the cut this time. So we need to do what we can, respecting, of course, that not all countries are ready to support the same kind of intervention, but at least to raise the awareness and to make sure that while respecting the different national policies and settings, there is a joint effort to make sure that we can save lives. And we had very interesting today, both from those who made the presentations and those who are the attendants and those who asked for the question. And I really want to thank you very much for that. Thank you very much.